Michael Bloomberg exposes RFK Jr.'s dangerous vaccine misinformation. America's health is on the line, and the stakes have never been higher. Imagine a nation where the person responsible for protecting public health is in fact one of its most vocal critics. That's exactly the situation we're facing with Robert F. Kennedy Jr. serving as Secretary of Health and Human Services. But here's where it gets controversial. Many believe that confirming Kennedy was the single biggest blunder Senate Republicans have made this year. Is it too late to fix this mistake? Not yet, but the clock is ticking. Since stepping into his new role, Kennedy has, in the eyes of many experts, unleashed a wave of misinformation that threatens the well-being of millions. Unless lawmakers take meaningful action to rein him in, the consequences could be dire, not just for public health, but for the president's reputation as a leader on safety and wellness. Let's break it down for those new to the debate. Robert F. Kennedy Jr. is not a doctor, nor does he have any formal background in medicine or public health. Instead, he's become widely known for promoting what many scientists and medical professionals call junk science, ideas and theories that lack credible evidence and often contradict established research. And this is the part most people miss. Kennedy's ride to such a powerful position was always risky, because it gave him a national platform to question the safety and effectiveness of vaccines. The result? A growing number of Americans are now skeptical of vaccines, which public health officials warn could lead to preventable illnesses and even deaths. This isn't just a theoretical concern. Real people are being affected, and the ripple effects could last for years. Some argue that Kennedy's influence is eroding decades of progress in disease prevention, while others claim he's simply encouraging healthy skepticism. But where do we draw the line between questioning authority and endangering lives? Here's a question for you. Should someone without medical expertise be allowed to shape national health policy, especially when their views run counter to scientific consensus? Or is it important to have dissenting voices in positions of power, even if their ideas are controversial? Let's open up the discussion. Do you agree with the critics? Or do you think Kennedy's appointment could bring much-needed change? Share your thoughts below and join the debate. Michael Bloomberg calls out RFK Jr. over vaccine policy chaos, imagining a world where misinformation about vaccines can have deadly consequences. And that's exactly what's happening in the U.S. right now. Michael Bloomberg, the billionaire and former New York City mayor, is sounding the alarm about Robert Kennedy Jr., the current health secretary, who he claims is a peddler of junk science with a history of spreading conspiracy theories and vaccine skepticism. But here's where it gets really concerning. Kennedy's actions as health secretary are having a direct impact on public health, particularly when it comes to vaccine policy. And this is the part most people miss. His influence is not just limited to his own views, but is also being felt through the changes he's making to the vaccine advisory panel and the way he's handling the current measles outbreak. As Bloomberg points out, Kennedy has no medical training, yet he's been appointed to a position where he has significant influence over health policy. He's been using this position to undermine public confidence in vaccines, which is leading to unnecessary suffering and even death. The numbers are stark. Over 1,300 confirmed measles cases have been reported since mid-July, with 3 deaths, including 2 healthy children. And the worst part is that all of these deaths were preventable had the victims been vaccinated. But Kennedy's response to the outbreak has been woefully inadequate. Instead of using his platform to urge parents to vaccinate their children, he's continued to spread misinformation and present the safety and efficacy of vaccines as an open question. His approach is not literal. It's having real-world repercussions.